I'm Dr. Stephen Brazis, and I'm here today with two of my colleagues and very good friends, Dr. Locke Johnson and Dr. Michael Phelps. We're here today to discuss some questions pertaining to the oral surgery field of dentistry, which many of my patients have asked over the years. So, Michael, again to you. A lot of our elderly patients ask questions pertaining to having osteoporosis and how that'll affect them in various oral surgical procedures if they need those.
Well, osteoporosis in itself is not a contraindication to having dental implant treatment, nor is age. Age is perhaps a relative contraindication, but for a patient who is in general good health and able to take care of their teeth adequately, they are many times fine to have dental implant placement. Osteoporosis is treated with medications many times, and we can evaluate the quality of bone through radiographs that we take in the office or through a cone beam exam to see the general architecture of the bone. So that in itself is not necessarily a contraindication to having dental implant treatment or oral surgery in general.
Is there any special treatment considerations that you do for people in the case of osteoporosis?
Nothing in particular that we will modify our treatment for. If a patient does have a very poor quality bone, which we would have to evaluate on a case-by-case basis, then we may discuss with them their increased failure rate possibly for dental implant treatment, but that's a case-by-case basis. We'd have to evaluate each case individually.
Okay, great. So, Locke, I'd like to ask you this question. A lot of my patients are on Fosamax. I know that's a big issue nowadays and the complications involved with that type of medication. Can you give us a few words on that?
Yeah, Fosamax is in the classification of the bisphosphonates. They're designed specifically to alter bony metabolism in people that have cancer to try to prevent the spread of the cancer, and or people who have weak bones. It attempts to increase the density of the bone. Unfortunately, the increased density of the bone makes the bone not very vascular. Therefore, it loses or lacks the ability to heal, and therefore minor traumas can be very detrimental in that wounds can open up and you can get nasty infections. Now, fortunately, the majority of the people that are taking the bisphosphonates are taking oral bisphosphonates, and those really have no contraindication for any type of oral surgical procedure at this stage. It's the patients that take IV bisphosphonates. They're much more intense, they're much more dramatic, and the incidence of having exposed bone or infections related to those is increasing because of the awareness of the effects of the bisphosphonates. And there are current studies that will allow you to try to determine the intensity of the drug's effect on an individual, and that is a specific test called the CTX. And if you order the test, you can then determine whether or not the patient should be taken off of the medication, what is called a drug holiday, where they're removed for anywhere from 3 to 6 months from taking the medications to attempt to reverse the effects of the bisphosphonates. Unfortunately, there are no great answers right now in the whole subject matter of treating the complications related to them. And it's something that we're all looking forward to in the near future, coming up with solutions that will enable us to help manage those patients' problems.
Right. Thank you very much. All right. Well, I want to thank both you, Dr. Johnson and Dr. Phelps, for joining me today.
Thanks, Steve.
And for sharing your expertise with me and with our watchers out there. And I want to thank all of you for joining us today. I hope you found this discussion useful. I'd like to encourage you to check out more of my videos at www.totellthetooth.com. Please also check out my office website for general dentistry at www.toothhaven.com. Until then, this is Dr. Stephen Brazis wishing you all the best of oral and general health.